Hello, my name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday the 17th of February. Firstly, let me go to the numbers, and actually our number of inpatients who are COVID positive within the first 14 days of diagnosis has gone up ever so slightly since this time last week. Today it's 71, whereas last week I reported 64, and we've seen that throughout the week, the numbers staying there or thereabouts, though importantly the number of patients who are COVID positive who are over the age of 85 has dropped quite dramatically, and we really do think that is an impact from the vaccination programme which started in that age group back before Christmas, and that absolutely reinforces the importance of everybody who is in an at-risk group becoming immunised, because we really are seeing something quite striking changing in the data. So we've got 71 within 14 days and another 82 patients who had their first diagnosis of COVID in hospital and are in because of COVID, so that takes us up to 153. So I think that story is a plateau as far as inpatients is concerned. Yesterday we saw 14 new diagnoses of COVID for inpatients, so we're still seeing some people who are really poorly with COVID. It is still a big problem for all of us, and therefore we have to remain really vigilant, and the message around getting immunised if you're in an at-risk group is really clear. I'm sorry to report that we had 13 deaths since this time last week, where COVID is within 28 days. I think that's a little bit lower than some previous weeks that we've reported, and it may be because of the change in the age profile that we're seeing. That takes our total to 715 deaths of COVID since the beginning of the pandemic, sometime nearly a year ago. In terms of community figures, we are still seeing, this is a good thing, a progressive decline in positivity rates. So per 100,000, Blackpool is now showing 154, whereas this time last week it was 202. Fylde is showing 155, this time last week it was 209. Wyre is showing 112, this time last week it was 194. It's quite a big drop, and again, quite importantly, the positivity rate in the over 60s is falling, and I think that is a really good piece of news, because we know that age is an independent risk factor for getting very poorly with COVID. So seeing that number coming down should be really positive news for all of us. Within the Trust, we've immunised over 15,000 patients and staff now using the Pfizer vaccine mostly, although we are using some AstraZeneca Oxford vaccine as well now. But the big story really around vaccination is it continuing to operate at a high level at the Winter Gardens and also through GP practices. If you're over the age of 70 and you haven't had your vaccine and you haven't been called for your vaccine, then you should have, and I'd urge you to dial 119 and speak to them about getting a slot at one of the centres to get your vaccination as soon as possible, because the programme will roll out progressively and we really need to make sure we've covered off at-risk groups, the highest at-risk groups, as early as we possibly can. Within the hospital, we are testing as many of our staff as we can weekly using a test called LAMP testing, which is a spit test rather than a swab test, and that will gradually roll out across our trust and then other trusts across Lancashire and South Cumbria as the preferred test for asymptomatic staff. So if colleagues are watching who are not yet enrolled on the LAMP programme, please could I ask that you do that as a matter of urgency, both to protect yourselves and of course to protect colleagues and our patients. And for members of the public, still to say, if you have any flu-like symptoms at all, really, I'd urge you to get a test for COVID. There's tons of testing capacity. The Fylde Coast has done really well in regional and national comparators in terms of the amount of testing that we've undertaken. And that, of course, gives us a greater ability to identify and control the disease. So if you've any signs of a flu-like illness, please get tested. The way to do that is by dialing 119 or going on NHS Choices and following the links there. So that's the update for today. I think we're not out of the woods. You know, I was hoping to see the numbers come down a little bit more. They're flat. The community numbers are going in the right direction. I think we have to stay vigilant for quite a long time to come yet. Thank you.